You still compared what we were December 1st. Look at December 1st. Have a little ways to go from where we had before we had our first case. But again, the hospital admissions, those are beautiful sights to me as well. Look at how we've declined so rapidly in our hospital admissions. Fewer people in hospitals, people getting out of their lives, self-resolving at home. A lot of people are experiencing symptoms, but they're back home, they'll be back to work, back to school in a short time. So I still want more New Yorkers to get that second dose. 95% plus, and then that's as high as the CDC keeps track of, so I'm going to guess we're a little higher than that even. But let's finish the series. Just get it done. But look at the numbers for children. And as we talk about what the future is going to bring for the school year, et cetera, we're focused on the fact that those numbers, as much as they're going upwards, are not where they should be. They're nowhere close to what they should be. And the good news is Pfizer is making great progress on getting a vaccine to the FDA for approval, possibly by the end of this month, for children under the age of 5. But why don't we just take care of the 5 to 11-year-olds first? I mean, their older siblings are getting vaccinated. We know it's safe. Tens of thousands of people, hundreds of thousands of parents have agreed that this is a good thing for their children. So we're going to continue our promotions, make sure that there's whatever incentives kids need to have, ski packages, family incentive, pop-up vaccination sites. We'll keep it all going. But right now we're taking 2 actions to remove barriers for parents to get support. And one of them, in early December, President Biden required Medicaid to cover COVID vaccine counseling visits. What's that all about? Well, in order for to be reimbursement for a doctor to talk to someone, they have to have a box you can check and say that is a covered activity, and so they required Medicaid to cover the counseling visits, regardless of whether it ends up in the outcome of a child getting a vaccine. We believe that this should be extended to all insurers, not just for people who are covered by Medicaid, but for all families. So we're calling on the federal government to issue guidance so all insurers can cover COVID vaccination consultations for families and children. Also, the insurance companies should be covering the incentives. I mean, help the doctors, help the medical professionals, offer incentives to families and for children to do this. Department of Financial Services will offer guidance on this. They offer all kinds of wellness incentives. I mean, you get incentives to go join a gym, for example, or eat healthy, or go to certain restaurants. Let's get them being creative to help create incentives for this so we can get over that hump, get those last group of kids vaccinated so we can make sure that they're safe in schools and wherever they go. So we're targeting, we're going to be talking to our primary care doctors about this as well. All right, boosters. This is good news as well. Look how high they are. We have almost 6 million people boosted already. People who are eligible, what are you waiting for? This is the extra security blanket you can wrap yourself in and say, no matter what happens, I'm protected. And if I do get it, the symptoms are so much more minor than they would have been had you not been boosted. So that's great news. Also, you hear a lot about this phrase, long COVID now. This is an institution that is studying it. We're proud of the work that's being done here, and as well as by Dr. Katz and New York City Health and Hospitals. They are creating they have COVID centers of excellence. They're the first public facility in the nation to be addressing long COVID needs. But I've been asking my health team for a couple of weeks now, a couple months actually, to get us real data on this. What does long COVID mean? Is there a difference in individuals who are actually very sick with COVID and they're more likely to have long-term symptoms? Or can someone who just tested positive, didn't experience real symptoms, but may have some lingering health effects? And we have to make sure insurance companies are going to cover this into the future as well. So we know that there's very strong physical, mental, emotional, and actually psychological symptoms associated with this. And we want people to take this seriously. So therefore, I've asked my Commissioner of Health, Dr. Mary Bassett, to convene a panel with experts from all around to assess this, spend the day Thursday the 3rd from 8:45 to 2:30 examining this. It'll be open to the public. It's a free virtual event. It'll be on DOH's website. But doctors, people who are experiencing long COVID, let's talk to them about what's going on. And our goal is to gather information, analyze it, find out treatments, and give people hope. Because there's nothing more disturbing to someone than to have gone through COVID and feel that you're through the whole worst experience of it. You recovered, but the symptoms are lingering, whether it's cardiovascular, whether you're exhausted, difficulty concentrating. And we need medical professionals to treat this seriously, and understand ways that we can start giving us ideas on how we can treat this. So let's address that as well. So we believe we're finally turning the corner on the winter wave. Just like the snow is melting, hopefully these numbers will continue to melt away, and we're going to continue preparing, though, for whatever the future brings. That is our responsibility. Always prepare for the worst and be happy when it's not that bad, just like you prepare for a big snowstorm. It's all about what you do to prepare. So, and again, building back the ranks of our workforce, critically important, strengthening the entirety of our healthcare system so we are never again as vulnerable as we are right now. And as much as we love having our visitors from the Department of Defense and all over, bringing their talents and their passion to give just a little bit of relief to our hardworking medical professionals, it'd be nice if we didn't have to do that. And we look forward to finding the day we get through this, get to the other side of this, and just as it feels like spring's around the corner, it feels like the COVID winter is starting to melt away as well. So we're going to continue leading the fight. We have the tools. We're going to keep things open as we always have. The whole objective to everything we put in place, vaccination requirements, masking, et cetera, was all for the dual purpose of keeping people healthy, but also keeping our schools open, keeping our businesses open, keeping our lives once again being as normal as possible, and that's what we've been able to achieve through this. So, so thank you, everybody. And with that, I'll bring back our Dr. Say it again, Captain Elizabeth Huizinga, Captain Huizinga, who hails from Fort Hood. Okay, let's find out from someone who actually does this and is using her medical talents to lead an incredible team who are here. Again, as I said, the cavalry has arrived. This is it's a gift to all of us. And I had a chance to speak to all of them, and I just wanted to thank them personally on behalf of all New Yorkers who are benefiting from their experience and their desire to serve. These are true public servants. Captain?
Good morning. I'm U.S. Army Captain Elizabeth Huizinga, an emergency room nurse and the officer in charge of the military medical team here today. My team and I, part of the Department of Defense's support to the Federal Emergency Management Agency and the whole of government response to the COVID-19 pandemic, are here at New York City Health and Hospital at North Central Bronx at the request of the state of New York and in response to the latest surge in coronavirus cases throughout the borough. Since our arrival last week, NCB hospital staff have gone above and beyond for seamless integration. We are very appreciative of their efforts and feel like a part of the team. My soldiers are active duty military doctors, nurses, medics, and respiratory therapists that come from a variety of military installations from across the nation, bringing with them an overabundance of medical experience and knowledge. Our attitude and expertise, coupled with that of the NCB hospital staff, will prove invaluable as we work together to tackle the rise in hospitalizations from the coronavirus. While the duration of the federal military assistance here will be determined by an ever-evolving situation, our team will help for as long as we are requested by FEMA to support the state. To move ever upward, as the state motto suggests, is our commitment as we continue to partner with civilian healthcare professionals to relieve pressure on the hospitals and alleviate suffering. Thank you. I will be followed by Congressman Adriano Espaillat.
She pronounced my name right. Thank you, Captain, and thank you, Governor, for your great work, and of course, thank you to the team, the medical team here. This is sort of like the epicenter of the pandemic. You know, this week we'll have a minute of silence for the 900,000 Americans that we've lost in the pandemic. Almost 1 million people have died in this pandemic. And I remember back in February, 2 years ago, February, March, April, we would have every Wednesday evening, we would have a call where Dr. O and Ms. Quinones, who used to be the head of the of this hospital, and Health and Hospital Corporations, and New York Presbyterian and Montefiore and Harlem Hospital, that will call in, and they will give us the numbers. And these zip codes here in the Bronx were like, we were getting hammered right here. This was really bad. And we were able to successfully work with Dr. O and put up a testing site right by Lehman College in the parking lot there and begin to test. And Councilmember Dinowitz was helpful, and our board president, Vanessa Gibson, was helpful. And so this is a neighborhood that really felt the pandemic. We were like in new ground. So you are now the folks that are coming in to help out, because this is still very much among us, and we're sort of like learning every day how to deal with it. But these zip codes and the workers from 1199, heroes, they were out there in the front line exposing themselves. Some of them died. That's how difficult this all was and is. And so we thank you for coming to the Bronx. The West Bronx was particularly hit hard. The entire West Bronx border and the zip codes there were particularly, if you look at the numbers, really bad numbers. And so we need to work. This healthcare industry is not only just important to the borough of the Bronx because of the services that it provides, but it's also the biggest employer of the Bronx. So it's important to our economy as well. And so we thank you so much for stepping forward and providing the help that we need to save lives and to really help us hold our hands and help us going through a new era, the post-COVID era. We don't know. This is new ground, so we need to work together to ensure that we move forward together. Gracias a la gobernadora, a la capitana, por estar con nosotros, los líderes, el doctor O, George Priestley de la 1199, el concejal, la presidenta del condado, los líderes de la corporación de hospitales de la ciudad de Nueva York y naturalmente los soldados que vienen aquí a ayudar a nuestra comunidad a cruzar por este periodo de una pandemia, ayudándonos diariamente a salvar vidas. Thank you so much, all of you, and keep the faith. And now with that, I would like to introduce to you brand new, really brand new Bronx Borough President, Vanessa Gibson.
Who's counting? I'm only in week 5, but who's counting? Good morning, everyone. Thank you so much, and welcome to North Central Bronx Hospital. I am so honored to serve as the Bronx Borough President, and I want to first acknowledge and thank each and every one of you for being here today. It's a very important reason why we are here, to continue to affirm our commitment to caring for all New Yorkers, to make sure that we invest in our healthcare workforce, and at the end of the day, to make sure that we do everything possible to protect and save lives. I want to acknowledge our president, Joe Biden. President Biden has been an amazing leader. He has worked around the clock to never forget New York. And our governor, Kathy Hochul. Governor Hochul has been a friend to the Bronx. She is here all the time, checking in on us to make sure that our borough is safe and we are good. Certainly the horrific fire that we faced on January 9th that claimed the lives of 17 neighbors has reminded us of the work that is done every single day. And I want to thank you, Governor Hochul, for your support, for lending your office and your staff, being amenable to conversations as we move this borough forward. So many have been involved, our healthcare heroes and sheroes every day. I'm so grateful for Dr. Mastromano, our president and CEO of Jacoby and North Central, Dr. Jones. It's good to see George Gresham, our partners at 1199, and Ms. Pat Kane from the New York State Nurses Association, and really all of my colleagues in government. It's good to see you, Dr. Mitchell Katz, our president of Health and Hospitals, and thank you, Captain. Thank you so much for assembling this incredible team, the U.S. Department of Defense and the military team that is assembled here today affirms our partnership as we move forward. We know that COVID-19 and the impact that it has had on this country. The Bronx faced one of the highest death rates due to COVID-19. Many of our residents every day live with underlying health conditions, and health disparities that we have faced for many, many years. And we are no stranger to struggle and hard work. But through it all, through dedicated teams like the military team assembled here, who are dedicating their time and their labor to come here to North Central to provide services and relieve the burden on our medical staff, our nurses and our doctors and respiratory therapists. We are so grateful that they have traveled from near and far to come here to North Central to provide the medical expertise and the support and the continuity of care with diverse and language access that so many of our residents and families here in the Bronx rightfully deserve. And as we continue to tackle COVID-19, we're grateful when you hear the numbers, the positivity rate is going down. There was a time for us in the Bronx, many of our neighborhoods were well into the 30s in terms of the positivity rates. And now we're in single digits. That is a sign of progress and hope for a better tomorrow. But we cannot rest. While we see these numbers, we are not satisfied until those numbers get down to zero, where we'd have no longer cases of COVID-19. And so it means our work is not done. It means we still have to collaborate and make sure that we have the convenience of testing sites and vaccines and booster shots. We're continuing to be creative and meeting residents where they are, going into schools and community centers, working with clergy and faith-based leaders, and so many of our partners, our FQHCs and health organizations, who are credible messengers on the ground. They're serving our residents every single day, and our residents feel comfortable going to these spaces. So we have to continue on that work. We have to be very deliberate in this work and very collaborative as we partner together, because at the end of the day, our responsibility as elected officials and advocates and CEOs is to make sure that we protect our fellow New Yorkers, we provide them with affordable, quality health care, and we make sure that we do our part to educate so many of our residents. So I am proud of this partnership. I did see last week that the U.S. military team was at Coney Island Hospital in Brooklyn, and I said, okay, it's only a matter of time before they get to the Bronx, and I'm so grateful that they are here at North Central Bronx. We need the support, we need the attention, and we need the priority. And thanks to our governor, we are getting it here at North Central. So again, I want to say thank you to everyone, to all of my colleagues in government. Thank you to the military team who is here. Thank you for supporting the Bronx in a major way so that we can save lives and protect our fellow neighbors. I am so honored to next introduce someone who has been a great leader. We've worked with him as the borough president and certainly during my time as a member of the New York City Council. He is our president and CEO of New York City Health and Hospitals. Ladies and gentlemen, Dr. Mitchell Katz.
Thank you so much.
Thank you, Dr.
Thank you
Katz.
so much. I'm so filled with gratitude as I stand here, and I want to start, Governor, when you first became governor, you and I talked, and what you promised is that all of the governor's office would do everything possible to work with us. And that has been absolutely how it has felt. You have hired the smartest leaders, Dr. Mary Bassett, Commissioner Bray, Catherine Garcia, people that we know that really care deeply about New York City, and they've been phenomenal to work with. And we're so grateful to you for, really wanting to work together and to fight this pandemic together. And at every point, you've always been there for us, and we're just incredibly grateful to you for that. And I also wanted to say, as a practicing physician, my patients are suffering from long COVID. They have a lot of respiratory problems, as you're saying. They talk about a brain fog, neurological changes. We're very proud that Health and Hospitals has centers of excellence so that we can take care of them. But I think this is like long COVID. It's going to be a long haul to really healing New York. So thank you, and Congressman, we're so proud that you're here. We're so grateful for the borough president. We're so grateful to this wonderful department from the Department of Defense here to give us our help. We so much. And my last thank you, of course, is to my doctors, my nurses, my support staff. Governor, these are such amazing people. In March of 2020, this hospital was full of people on ventilators. And who was taking care of the people on ventilators? My midwives. My midwives were the ones in the ICU working the drips. Everybody showed up, everybody came, you know, when everybody else was sort of on their Zoom meetings, you know, in their apartments. It was my nurses, my doctors, my respiratory therapists who came to work. And it was as true, you were raising the issue of snow. I remember on Saturday, appropriately, people said, if you don't have to get out of your house, stay in your house. But of course, my workers came, right? Pat's workers came, Local 37, all of the great union partners, our people came. And those are the kind of people that we appreciate, and I'm so grateful. So with that, I'm going to close us out. Governor, are you going to take the mic for questions?
I'm just going to invite one. I did make one mistake. We're not always perfect. Pat Kane is not the treasurer as much as every conversation relates around money with her. So I had this treasurer. Can we get more money? So I'm thinking she must be the treasurer. She is the executive director, and I want to make sure that I acknowledge that as well. And I do want to thank everybody for coming. And we'll take a picture. Pat and George, if you want to come up here, we'll get the picture.
Thank you, Governor. Thank you so much.
Tough job you have, my God.
No, you have it much worse, but your support makes it better.
Thank you. You all set? Want to move everybody out? Move everybody out? Are you all set? Sure. I think so. Okay. All right. All right, just trying to get the room quiet for all of you to be able to do your jobs. Zach, you're in the front row.
Governor, I wanted to ask you to comment on the redistricting lines. First, Congress were put in. Some people were accusing the Democrats of gerrymandering a little bit, saying that they criticize Republicans, but then they kind of do it themselves. I'm wondering your thoughts on that. And then the news of the day, specifically the state Senate adding 2 more seats in New York City seems like they're kind of, hacking the game a little bit, rigging the game a little bit. I'm just curious to get your response.
First of all, let me just state that ensuring fair representation for New Yorkers is important. And I also know, as someone who's had some experience with this, that candidates also need to know certainty as soon as possible. They need to know the lines so they can make a decision. Do they run? Do they not run? What is involved in there? Because the elections are literally just a few months away. Also, the voters need to have certainty as to who will be representing them. So we need to make sure that the redistricting process is moving forward at a rapid pace so we can answer these questions. What do the districts look like? Who is running? So we don't want to see further delays in this. But the role that I play is simply reviewing the maps after they've been approved by the legislature. That is when I will be involved in the process. And also, again, I will assess the maps when they are presented to me when they're in their finality, because it's not over till it's over. There's still time for more conversations and back and forth, so I will wait to see what is presented to me on my desk at such time. I just really want this process to keep moving forward. We need the certainty, the clarity. Time is slipping away quickly. Yes, yeah.
What did you talk to Manhattan DA Bragg about? What message did you want to convey to him? And also, even though you do have the power to appoint a different prosecutor or to remove him, would you consider appointing a prosecutor who just does perhaps gun cases and take that out of his hands?
Well, my understanding is that he just hired an individual to handle gun cases in his office. So he is taking the steps he needs to accomplish our shared vision to make sure that we ensure that this city is as safe as it can be. Manhattan, this borough, the city of New York, they have to be safe. We also have to ensure that there is fairness in this system, that we still have a system of justice. So those are my values. Those are values we spoke about, but also making sure that we are giving that confidence by taking actions. What does that look like? So an individual who's been on the job literally weeks will have an opportunity to show the commitment to dealing with all levels of crimes, something that he was very much aware of was important. We talked about safety on the subways. I want to make sure I can get New Yorkers to feel safe and secure and take that subway to come for their jobs or for entertainment. That is the lifeline, and he understood that this is an area where we can improve public safety as well as prosecutions of people who violate the laws. I mean, that's the bottom line. We talked about prosecution of individuals who are violating the laws. And so it was a very productive conversation, and certainly, he needs to do his job, and he's doing it right now.
Do you think he took enough steps, or this one step in hiring this gun person, is that
No. You judge by the balance. I mean, you're going to see, again, someone who's been on the job a very short time. People like I cut some slack. He's literally been on the job a quarter of the time that I have, and I've been on the job a very short time. So let him work with the other district attorneys. I know they have conversations. Let him work with NYPD and the mayor to identify areas where they need to have prosecutions and work together. Let the process play out so he can do what he needs to do, which is help establish that sense of security that New Yorkers are looking for, and that involves gun prosecutions. And as you all know, I was just up in Albany convening the very first Interstate Gun Task Force meeting. Never before have 9 states been represented in one collective meeting, including the NYPD, district attorneys, the mayor of New York participated, and I thank the other governors who understand that a large part of our problem in the city is the illegal guns that are flowing into our borders. Despite our strong gun laws, they're coming from elsewhere, something the mayor and I talk about on this. And the district attorneys have a role to play when those guns are found in our city as well. So there is a whole system of individuals who are all striving for the same goal, which is to drive down the gun violence. And it is not a New York City or New York State phenomenon. We know that. We are still statistically a safe city compared to others. But that's not how we're going to judge ourselves. We need to drive down the crime rate and enhance people's sense of security in order to have the full comeback we need. So there's a lot of individuals involved in this process, and let us do our job to work together. As a governor, my responsibility are those borders. This is where I can use the clout of my office to focus on gun interdiction efforts and surveillance in other states like Pennsylvania, individuals who may be loading up their trunks with assault weapons, bringing them up 81 and heading into Upper Manhattan and the Bronx, where we're seeing the highest concentration of these guns. But I will continue to play that role. The mayor has a role to play, the district attorneys, and people need to know that we're working very hard collaboratively to make sure this city is safe.
Governor, given you already moved the mask mandate deadline to February 10th, given that that's before Super Bowl weekend, which you've talked about as a sort of a known gathering spot, and it's before winter break for kids when they're with their families, realistically, is there any scenario where you remove the mask mandate before the end of February?
It's February 1st. I want time to continue doing what I'm doing, and I don't just look at the numbers, and I assess them intensely every day. Trends, as well as our vaccination rates in areas, as well as hospitalizations. But before any decision is made, I'm going to continue having conversations with the heads of hospitals and continuing our conversations with school superintendents that we have been, and other people that are affected by what we do, and business leaders. So we'll come to the right decision. And as I mentioned when I first announced, as we knew that this was going to expire February 10th, in anticipation that the winter surge will be heading down, and it is. We're in a much better place. But we have to decide what that looks like. We're not prepared to throw in the towel and say we're done fighting COVID. We are so far from that. And that is why I'm continuing to ensure that our 85 million testing kits, more than any state, are getting out to the nursing homes and the places of worship and the hospitals where we need them. I'm making sure that we continue to have vaccination sites for kids, the pop-ups, more access, getting masks in nursing homes and places of vulnerability. So we're not taking our foot off the gas when it comes to fighting the pandemic. The masks are one element of that that'll be assessed based on criteria that I just mentioned. And so we'll be happy to let the press know when a decision has been made on that. But we know it's coming.
In general, what do you need to see to be able to have confidence in rolling back some of those regulations? I know you were trying to shy away from specifics here, but on that positivity chart, on the hospitalization chart, what in general do you want it to look like to be able to say you're able to roll that back?
And that's a good question, and I don't shy away from anything, just I'm laying out the process by which we are making the determination. I say we, because this is not the governor of New York sitting in her office saying, oh, let's pull a number out of the hat and see what sounds good. This is in consultation with experts in Washington. I was there yesterday, meeting with Jeff Zients, meeting with medical experts, talking about this. What trends are they seeing? What are they seeing in other states and other parts of the world? Also, I have an incredible health commissioner, Dr. Mary Bassett. I need her input, as well as I continue to do, talk to other leaders in hospital areas and nursing homes, and also just assess that information. In addition to the 3 data points I mentioned, rate of infection, how fast it's falling, is that sustained? Is it a couple of days we're looking good? Is it a downward trend? Which is why we look at the 7-day average. Looking at vaccination rates, and we're doing well in some areas. We have a lot of growth areas in other parts of the state, and I want more kids vaccinated. That will be a driver. I want to see more children vaccinated to know that they're safe when they're in schools as well. Also, hospitalizations and capacity. We're doing much better. We're doing much better. But look who I just had to bring in. I still had to bring in the Department of Defense to help with our staffing issues here in the Bronx and in Coney Island and in Buffalo and Syracuse. So I think that sends a message that yes, the trends are great. We are optimistic, but also we take this seriously, and we're not through it just yet. I'm happy with the trend we're on, but we're not saying it's over. All right, thank you, everybody. Appreciate you coming out.